here today with John McMenamin, and he's been talking at the college conference in Auckland about early pregnancy assessments. And so you've got some tools for GPs, I hear.
Yes, so we've developed a tool, Sam, for general practice. It's currently a medtech embedded tool that allows and guides you through early pregnancy assessment. So it helps a doctor or a nurse identify the risks when somebody presents an early pregnancy.
And so I know that for me, when I'm seeing my patients and things, it's sometimes like, do I get everything done in time? So what sort of things does it cover?
So it covers obviously the clinical risks in early pregnancy, which are important, and then it covers the various psychosocial risks that are important for us to address. And of particular importance is it does ensure that we address the issues around smoking and alcohol use during pregnancy. It automatically writes the scripts for you, so you don't have to remember that yes, they need folic acid and iodine, and it automatically loads the recall for the pertussis vaccination after 28 weeks. Reminds you if it's flu season to give them the flu shot. And also it summarises all the pregnancy risks so that you can print a referral form for a midwife and allow that to go to the midwife. And in our region as well, if there are risks, that automatically with consent will go off to what we call a pregnancy navigator. And so this is a midwife who will contact the woman and say, oh, there's some issues your doctor's concerned about and can we talk about those?
And do you envisage nurses being able to use this tool as well?
Very much so, and in fact, if we look at what's happening around the country, we find that a lot of the early pregnancy diagnoses and management is being done by practice nurses. Often it's to the practice nurse that the patient will present first of all to get a diagnosis of pregnancy, and sometimes just simply because of the way in which the practice is organised, it may well be the nurse that has the time to go through those early pregnancy assessments, particularly when you're thinking about risks around domestic or partner violence, risks around mental health. Sometimes that needs quite a lot of time to draw out, and the tool's been set up in a way that it can be partially completed and then added to, or it can be completed in a perhaps extended time type of consultation.
So has it, tell me a little bit about the development and piloting, if it's been done and that sort of stuff.
So we developed the tool with some funding from the Health Promotion Agency, and the Health Promotion Agency is obviously very interested in this space because it's doing work around early pregnancy and alcohol use at the moment, and running a program at the moment trying to identify if any woman believes that she potentially could be pregnant, to be aware that alcohol use has got potential problems associated with it. And so with that funding, we developed a tool that we could trial in Wanganui. So far we've trialled the tool for about 18 months or so. We've had about 250 uses so far, which is great. So we know we're reaching about a quarter of the women in our region that are pregnant and having that assessment. What we're finding is that practices that are very clued up to identifying who are their pregnant women and having an organisational response are using the tool, but that sometimes it's actually very hard to know in the practice who's pregnant. So one of the things we realised early on that we needed to do was to find a way in which you could record in the notes easily that somebody was pregnant that would be identifiable. So we've developed a little tool, a button that goes on the dashboard. So whoever diagnoses the pregnancy or sees any other information about pregnancy, like a scan or a letter or anything like that, they can click on the button and it just records that the person's pregnant, and then around their dashboard it puts a nice pink square. So for the entire pregnancy, that woman will have a pink square around their dashboard reminding you that they're pregnant, and it will give you a little prompt saying, have you completed an early pregnancy assessment on this woman?
And can you unclick that? So if they
yes, obviously there are some situations in which you need to unclick that, and so it goes to the estimated date of delivery and then just unclicks itself. But if you have a positive pregnancy test in the notes, a little reminder comes up and says, positive pregnancy test in the notes, have you assessed this woman for pregnancy? Is the woman actually pregnant?
Well, that sounds good. And how is it going to be rolled out to general practices?
So we're still just completing the sort of field evaluation of it, and then that tool is going to be available. It'll be shareware. There's a lot of information on the Health Promotion Agency's website. So anyone who just Googles HPA GP pregnancy will be able to find that website easily. Otherwise, just negotiating through from their main page. There's a lot of information there about how to get it. The tool's available now, and we will be actively promoting it and making it available as essentially freeware for the country.
Oh, cool. It's exciting that it was free.
Yeah,
that's pretty good. So, and for the mums and people who've been using it in your Wanganui, have they found it very easy to use? And
yes, so essentially from the viewpoint of the mums, what's happening there is that they're experiencing in general practice really good early antenatal care, which means that they're in front of their doctor or their nurse for possibly 20 to 30 minutes, for some up to an hour perhaps, sometimes several times, and having a chance to go through systematically all of the issues that are important in early pregnancy. And quite a lot of comments you get back is comments from pregnant mums saying, "Oh, that was very thorough," or "Thank you for that," or "I hadn't known about that information," or some quite neat options on there. For example, it's got a button that links to find a midwife. So many women, of course, in early pregnancy haven't yet found a midwife. You can do that with them. You can click on it, goes to the Find a Midwife website, and helps them identify who they might want. So there's a few tools on there that are kind of user friendly and helpful as well as links to resources, so that if issues do come up that a woman is concerned about, you've got links to resources that you can share with that woman as well.
Well, that's great. And has it been well received by the midwives?
It's great because what it means is that the midwives are getting a report from their GP or practice nurse about what you've already done in early pregnancy, what you've identified. As you probably know, there's the gradual national rollout of the new midwifery recording form, what was developed through that Badgernet process. They haven't yet got that widely used in antenatal care, but it will become that. And this form has been written in such a way that it will automatically load into the Badgernet form.
Oh wow!
So in due course, we'll be able to send that information electronically.
Oh, fantastic!
That will be part of the newer developments in IT that are coming.
Yeah, no, that's really great. Well, so this sounds exciting, and thanks for talking to us today.
Great, thanks, Sam.